So understanding how the brain learns is really important for understanding how students learn in the classroom. So one of the crucial factors it's been determined in recent years that for some children it's the speed at which they can process speech sounds which is the underlying basis of their difficulty with acquiring both oral language and reading. So if we have a look at these two phonemes, ba and da, we can see that it's only the first few milliseconds, 40 milliseconds of these sounds that are different. The rest of the speech stream is identical. So if you're slow at processing speech sounds, you're not going to be able to distinguish sounds very accurately. And this is the underlying difficulty with many children with language and reading difficulty. So the Fast Forward program came out of the work of Dr. Paula Talal. She researched for 30 years and her research really was focused on trying to understand why it is that children who are typically developing in every other way have so much difficulty acquiring oral language and reading. And what she was able to discover in her research was that for many of these children, their issue was one of timing, or the speed at which they can process speech sounds. So based on her research, she then collaborated with other neuroscientists, Dr. Michael Mersnick, Dr. Bill Jenkins, and Dr. Steve Miller. And they came up with an intervention that we could use that directly remediates this difficulty. So if we were to listen to the two sounds ba and da,
ba, da,
and we have a look at the speech stream that we can, this is a visual representation of that speech stream, we see that it's only the first 40 milliseconds of those two sounds that are different. The rest of the speech stream is identical. So if you have a difficulty with the speed at which you can process speech sounds, you're not going to be able to distinguish these easily. It's kind of like having a fuzzy phonological system. And so based on this understanding that children are slow to process speech sounds, the Fast Forward programs have incorporated a technology whereby we stretch the sounds. So instead of only having 40 milliseconds to process the difference between the sounds ba and da, we now have 80 or 90 milliseconds. So let's have a listen to those.
ba, da, ba, da, ba, da, ba, da.
So the Fast Forward programs have incorporated this technology whereby in the beginning all of the sounds that the children are processing are stretched. This can be at just the level of a single sound or a syllable or sounds in words or longer strings of language like phrases and sentences. And as the children get more and more success at processing sounds at the slower rate, it automatically adapts and speeds up so that by the time they've worked through the module, the first module of the program, they're now processing at the normal rate of processing. So Talal's research has been replicated many times, and we now can even look at children as young as, before 12 months of age. So Dr. April Benesic has done a lot of work on this area in the last 5 or 10 years, where she now takes babies and toddlers in two cohorts. One where there's a family history of language and reading impairment, and children where there's no family history of language and reading impairment. And they're able to see that even at a very young age, we can see differences in how quickly these children can process sounds. So what they do with the little children is they condition them to turn their head when they hear a sound. So they have a puppet that lights up when they hear a sound. So they're conditioning the children to listen to a sound. And then they present two sounds. And they want to be able to see how close together do those two sounds have to be before the children can still perceive them as two sounds and not one. Isn't this fascinating research? And we can see now that there are differences in children's ability to do that before they're 1 year of age. So the implication for this research is that we know that these children are going to be at risk for having difficulty with developing oral language and later on reading. And so we can intervene early, because we know early intervention is the key to future success with language and reading.